She asked me, I want to have my wedding without Gummy Smile. Welcome back to our series of designing attractive faces. So again, don't think in your patient as just teeth and alignment. You are giving them their final look in life. And I'm happy to share with you some of my tips while you are treating your patients. For example, if I give you the chance to treat a crowding case or spacing, or a case of class 3 in which you have anterior discrepancy, or if I give you the chance to treat vertical discrepancies, which one of them will be your favorite? Which one of them will be the easy one for you? I'm sure most of us will go for crowding or anterior discrepancy, but most of us, we are avoiding vertical discrepancies, and we feel that the vertical dimension is a very challenging one. So I'm happy to share with you some of the tips or my way of treating vertical discrepancies. And for me, vertical dimension cases, they are the most beautiful cases in my practice. So let's see the next case. And I'll use that case to give you a tip or a scenario how to avoid surgery, even in severe vertical discrepancies like Gummy Smile cases. So this is our patient, Jumana. Jumana, she is 20 years old, and her chief complaint was Gummy Smile. The etiology of her Gummy Smile is increased lower facial third. So the issue is in the bone, not in the teeth. You can add to that she has proclined upper and lower incisors. And by the way, this is her consultation smiling photograph. And as you know, during the consultation visit, your patient will not give you their normal smile. They will give you a formal smile. But again, taking smiling photographs is free in your practice, so why not to take serial smiling photographs for your patient to address their issue. So we have a challenging malocclusion. We have increased lower facial third, we have Bimax, and we have Gummy Smile. And the other challenge is she will have her wedding after 1 year. So she asked me, I want to have my wedding without Gummy Smile, doctor. So you need to have control on your cases, as we have said. So these are the intraoral photos for Jumana. So you can see that the upper and lower incisors, both of them, they are proclined. And the lower arch, in addition to the proclination, is crowding. So as you know, once you align the bottom teeth, you will have more proclination. And if you want to deal with the increased lower facial third, I mean you want to do impaction, this will give you even more flaring of the upper incisors, and already are proclined. So you need to have control in such case. So again, as we have said, the ultimate way of doing things is what's your problem in such cases. For example, if you want to do impaction for the maxilla, what are the unwanted forces in your practice? So as you know, we'll have proclination. So the flaring or proclination of upper incisors will be the outcome or the reactive forces for your impaction. So ultima will come to you and it's fine. If you have this issue, I'll give you the right torque, which is the retrocline torque. So by this, I will control the proclination. The other thing, what about the molars? The same. Most of us, once you impact the posterior part of the maxilla, you'll have flaring of the molars. That's why it's good to have something simple, like just picking the torque. So if you pick the negative torque values for upper molar tubes, all of that will minimize your unwanted forces and will give you the chance to have more control on your cases. And for the negative torque values for the molars, with Damon tubes, if you check with me, these are -18 for upper sixes and -27 for upper sevens. All of that for your help to prevent the flaring. So let's go back to our patient Jumana. always remember to take intraoral photographs during the bonding session to register the torque. I was happy about the torque selection in her case. The only mistake was the neutral torque on the upper two centrals. So during the panorebo or the revision of my case, I changed their torque to be retrocline torque. So this is her buccal view during the bonding. This is my first Ultima wire or copper nickel titanium, and now we are in the flexible Ultima wires. Later on, I started to do the impaction. As you remember, she wants to finish her case in 1 year before the wedding. So I added my first two tabs, distal to upper canines. They were 6 millimeter, and I tried to put them mesial to the canines in the early cases. But nowadays, I think this is the right position to have more control on impaction and retraction at the same time. So I added that tab distal to upper canines both sides, and this is 6 millimeter. One of the tips is to flip the crimp bevel hooks. So this will give you more range of force, and this is more hygienic. Then in the next session, I added my posterior tabs between tooth number 6 and 7. And this is 8 millimeter tab. And I extended wide power chain from my tad below the hook of 6 till my canine. So that force will do two effects. Will do distalization for the whole buccal segment. Of course, I extracted upper and lower eighths. This will create space mesial to upper canines. Also, that part of the power chain will do the posterior impaction. And at the anterior segment, still I'm keeping my my 2 units wide power chain. So the net outcome of these 4 tabs will be both impaction and retraction. And of course, because I included only the canine, I should expect space creating mesial to upper canines. In her next session, I'll extend my posterior impaction and retraction till my crimp bevel hook. So try to deal with teeth in groups. My anterior segment from lateral to lateral, my posterior segment from canine till 7. So I'll do distalization with impaction for the posterior segment. I will create space mesial to the canine. Then in the next session, I will extend my power chain to the crimp bevel hooks to do the same retraction and impaction of my anterior segment. We keep doing that. So her maxilla is doing both impaction and retraction, and we have auto rotation of the mandible. And this is the panoramic position, and if you check with me, we changed the torque for the upper two centers to be retrocline torque. You remember I picked neutral torque. Then while I'm checking here lateral staff, I decided to pick retrocline torque for the two centers to prevent the flaring and to get more retroclination of my upper anterior segment. Also, I did reposition for the upper right canine, but you remember the torque was neutral torque. But one of the tips in my practice, I will ask my assistants to put a mark on the repositioned bracket so I can remember which brackets that I did reposition for them. But my assistant, she missed and she put a red color. This is not a Brookline torque. This was a neutral, and still it was neutral. So this is a wrong mark. It should be blue one. Still, we are doing retraction and impaction using the 4 tabs, and we expect to have the auto rotation of the mandible. And again, it's a good time to remind you with 4 tools to control your cases. So in her case, we used retrocline torque to prevent any flaring of the anterior teeth, do the impaction. In her case, her smile, even she came to us with Gummy smile, but I protected her smile arc, so I put the brackets on the centers at 5.5. And the good thing in her case, imagine I didn't need any elastics in her case. So we didn't need elastics. It was about auto rotation of the mandible. And in her case, of course, we needed 4 TADs. And this is her final occlusion. Still, I'm waiting settling. As you remember, we were in hurry because she was about to have her wedding ceremony. That's why I'm waiting here to see the buccal occlusion later on. Because of the settling, I can imagine the settling of the buccal occlusion with time. But she was happy about the outcome, and we had control. And the good thing with vertical discrepancies, like Jumana case, if you impact the maxilla, I like, by the way, maxilla excess, because once you impact the maxilla, that part of the bone will support the midface. So that part of her face was flat malar bone. She has depression below her eyes, but because we did impaction, we supported the cheekbone. So easily you can see the amount of bone support. So that bone here was reflected in the midface. So now we have cheekbone to support the midface. Also, you can see with me the jawline because of the auto rotation of the mandible. And we have more beautiful chin projection because we did retoclination of lower incisors to express her chin projection. So the 3 parts or maybe 2 parts of the attractive face were obvious in that profile: cheekbone, jawline with the chin projection. And the same for the frontal view. This is her frontal view. That part of her face was flat, but because of the impaction, easy you can see with me the jawline, the cheekbone. So this is the good improvement in her cheekbone, and easily you can see with me the jawline. So again, for me, I like vertical cases because once you impact the maxilla, you will support the midface, and you'll have auto rotation of the mandible to express the jawline. And for the smile, as you remember, this was a formal smile. But during the treatment, she became familiar with the practice. So now she's showing us her true smile. So this is her true smile. And the amount of Gummy smile, almost it's 5 to 6 millimeter. So for some doctors, maybe this is beyond the ability or the outcome of orthodontic treatment alone. But for me, I treated cases of 6 millimeter or even 10 millimeters of Gummy smile. And one of the tools that I'm using while I'm evaluating the face, something I call a triangle of symmetry. So maybe if you have the chance to join us in our 1-year program for Damon Ultima, I can share with you how to use these, let's say, modalities or way of diagnosis or treatment to get the best results of the face. So this is the detailing session. Before adding the TADs, we added 2 anterior TADs, distal 2 upper canines, and then we added another 2 posterior TADs between tooth number 6 and 7, and we did our impaction. And we were able to treat her before her wedding, and I'm happy to share with you her final smiling photograph. So this is her final smiling photograph, and all of that because of the excess in the beginning. So what you don't like in the start will be a plus for you and your patient. And again, all of that because of the 4 tools of having control on your cases. She was so happy. Of course, I did some sort of soft tissue contouring, and we'll cover that in our program in our last module for advanced finishing. So, and also we offered her a free whitening to express the white aesthetics. So it was a big change in her case.